Lifestyle and diet modifications help control blood glucose levels. Melissa Stanfill has a bachelor's degree in biology, and after working within the chemistry and pharmaceutical industries, she currently lives in Southern Illinois and enjoys a very active life, including many outdoor adventures with her family. Melissa is a master gardener, a master naturalist, and a gardening and canning enthusiast. Health and wellness have been a passion for many years, and she is excited to complete her master's in holistic nutrition and begin the next chapter of her life as a nutrition and wellness consultant. During this presentation, we'll go over what type 2 diabetes is, who it affects, the risk factors, and the dangers. We'll discuss the current treatments for type 2 diabetes, including the current recommendations by the American Diabetic Association. Then we're going to look into other options for managing type 2 diabetes, including a low carbohydrate diet, different forms of physical activity, and the importance of frequency, and a variety of herbal supplements. This will be followed by conclusions and recommendations based on the available studies, and the final slide will include the references for this presentation. Type 2 diabetes occurs when the body's ability to metabolize glucose is compromised. This can occur because the body fails to produce enough insulin, known as insulin deficiency, or because the cells within the body resist the effects of insulin, known as insulin resistance. Both cases result in above normal blood glucose levels, known as hyperglycemia. Short-term effects of hyperglycemia include blurry vision, nausea, and tiredness. Chronic elevated blood glucose can cause kidney damage, possibly resulting in kidney failure and the need for dialysis or transplant, and an increased risk for glaucoma and retinal damage resulting in blindness. Chronic hyperglycemia can lead to an increase in cholesterol and blood pressure, leading to damage to the blood vessels and heart. Nerve damage from hyperglycemia can cause tingling, pain, or numbness, which can be dangerous when coupled with the increased risk for sores and infections on the feet and skin of type 2 diabetics. A family history of type 2 diabetes, being overweight or obese, smoking, and low physical activity levels increase the risk of developing type 2 diabetes. Type 2 diabetes affects both males and females equally, and while Native Americans, African Americans, and Hispanic Americans are all affected at higher rates than Asian Americans and Caucasians, the single biggest risk factor for type 2 diabetes is being overweight or obese. 90% of Americans with type 2 diabetes are overweight or obese. Diabetes is currently the 7th leading cause of death in the United States. As of 2015, nearly 30 million Americans were living with type 2 diabetes, and an additional 84 million had a condition known as pre-diabetes, in which their blood sugar levels are elevated, but not yet at official diabetic levels. Without intervention, pre-diabetes can develop into type 2 diabetes. In addition to regular blood sugar monitoring, the American Diabetic Association recommends consuming a healthy diet consisting of fruits, vegetables, whole grains, lean meats, and low-fat dairy products, obtaining and maintaining a healthy weight, and engaging in regular exercise. The ADA, the American Diabetic Association, also recommends consuming approximately the same amount of carbohydrates at each meal, with carbohydrates making up approximately 45% of the diet. For those experiencing low blood sugar as a side effect of diabetic medication, the ADA recommends a temporary increase in intake of quickly absorbed carbohydrates such as juice or glucose tablets to help bring blood sugar levels up quickly. The ADA recommends type 2 diabetics should participate in resistance training on 2 or 3 non-consecutive days a week, in addition to approximately 30 minutes of aerobic activity on 4 or more days per week. In addition to these dietary and physical activity modifications, pharmaceuticals are also used to control blood sugar levels. Medications for type 2 diabetes seek to improve insulin sensitivity, increase insulin production, decrease the production of glucose by the liver, slow digestion, or increase the amount of glucose the kidneys excrete. Many of these medications have only a modest effect on blood glucose levels and often come with side effects like nausea, weight gain, low blood sugar, diarrhea, increased risk of yeast infections, urinary tract infections, heart damage, and fractures. Insulin therapy is also available, and while insulin is often more effective than other medications, it is typically more expensive and requires patients to use injectables. The efficacy of pharmaceuticals decreases over time, resulting in increased blood sugar levels and the need for an increase in medication. Long-term reliance on medication can also lead to an increased risk of side effects. In 2013, type 2 diabetics spent an average of 2.3 times more on medical expenses than those without diabetes. Reducing consumption of high-sugar fruits and starchy vegetables and eliminating the consumption of grains reduces the overall glycemic index of foods within the diet. In addition to low-carbohydrate fruits such as berries, as well as non-starchy and green leafy vegetables, low to moderate protein consumption plays a key role. The glycemic control seen with low-carbohydrate diets is not only due to the reduction in the glycemic indices of the foods, but also in the increase in insulin sensitivity. Low-carbohydrate diets result in nutritional ketosis, during which the body shifts its form of fuel from the traditional glucose to fat, resulting not only in improved blood sugar control, but weight loss as well. The increase in ketones in the blood decreases the amount of glucose that the liver releases into the bloodstream, further reducing blood glucose levels. Low-carbohydrate diets result in both blood glucose level reductions and a decrease in hemoglobin A1C levels to below the threshold for a diabetes diagnosis. When comparing a low-carbohydrate diet to a moderate carbohydrate diet that's recommended by the American Diabetic Association, which had 7% of participants reduce or stop their diabetic medication metformin, the low-carbohydrate diet resulted in 75% of participants reducing or stopping their medication. After 1 year on a low-carbohydrate diet, 94% of insulin prescribed participants reduced or completely stopped using their insulin. Adherence to the low-carbohydrate diet increased when support was provided, even remote or online support, indicating that long-term changes to dietary patterns are possible with support. Research found that the probability of a type 2 diabetic adhering to a low-carbohydrate diet was at least as good as the chance of adhering to other diet types, and frequently better. According to the American College of Sports Medicine, combining resistance and aerobic training on the same day is more effective at controlling blood glucose levels than performing either alone. While meta-analyses and comparison studies have shown increased insulin sensitivity, reduced hemoglobin A1C levels, and reduced fasting blood glucose in both strength training and aerobic exercise, underscoring that the type of movement might not be as important as just increasing the overall amount of movement, regardless of variety. Frequency of physical activity has shown greater impact on hyperglycemia than type of activity. The greatest impact on blood glucose levels were seen with at least 150 minutes of exercise per week. Strength training and aerobic exercises resulted in improved blood glucose levels for up to 48 hours after the exercise event, while high-intensity training resulted in improved levels for up to 72 hours, making high-intensity training a viable option for those physically able to perform the exercises, but looking to reduce the amount of time spent exercising. Because type 2 diabetics do not engage in enough physical activity overall, frequent movement in addition to structured exercise should be encouraged and included in management plans. Yoga has been used for stress management, physical conditioning, rejuvenation, and to prolong life for thousands of years. Yoga is still practiced today for these same reasons, but type 2 diabetics can reap additional benefits. Stress is a part of the daily lives for millions of Americans, and when left unchecked, chronic stress can lead to an increase in glucose in the blood, the body's way of preparing for fight or flight. In type 2 diabetics, the ability to use this glucose is impaired, and blood sugar levels remain elevated, causing damage. When practiced regularly, yoga significantly reduces fasting glucose, hemoglobin A1C, and improves insulin sensitivity. A variety of herbal supplements have been identified to aid in the control of blood glucose. Berberine is a natural compound that can be extracted from several Chinese plants and has demonstrated the ability to improve the efficacy of oral anti-diabetic medications, and researchers indicate its possible use as a concurrent medication with pharmaceuticals. American ginseng has recently been gaining in popularity with type 2 diabetics. American ginseng reduces fasting blood sugar and hemoglobin A1C. Research indicates that it can be used as a standalone intervention or as an adjunct therapy to pharmaceutical medication. Indian ginseng originates on the Indian subcontinent and has been used for centuries for many ailments. Blood glucose levels are reduced by Indian ginseng to levels comparable to the pharmaceutical drug Daanil. Not only does Indian ginseng stabilize blood glucose levels, but also improves insulin sensitivity and increases the amount of glucose skeletal muscles take in without any negative side effects. Blueberry both improves insulin resistance and suppresses appetite, making it possible to be used as treatment for both diabetes and obesity by reducing blood glucose levels, food intake, weight gain, and body fat. Blueberry can be used on its own or could be used to help to reduce weight gain side effects when used as an adjunct to pharmaceuticals. Capsaicin reduces hyperglycemia by raising the insulin level in the blood, resulting in a decrease in blood glucose. Capsaicin also increases thermogenesis within the body by increasing the expression of genes involved in lipid catabolism and by increasing energy expenditure leading to weight loss, making it a candidate for use as a standalone treatment or as an adjunct therapy to pharmaceuticals to combat weight gain. It's important for type 2 diabetics to work with their treatment team to create an individualized management plan for their type 2 diabetes. The management plan should be achievable and sustainable for the client. Included in this plan should be a restricted carbohydrate diet that works with the client's taste preferences, culinary skills, and social life, as well as a stress management plan, scheduled physical activity, and herbal supplement options should be identified for the client. In addition, a support system of family, friends, and community members will be critical to management plan adherence. While ample evidence of the efficacy of low carbohydrate diets to lower the need for diabetic pharmaceuticals exists, additional long-term, rigorously designed comparative studies into the ability to maintain healthy blood sugar levels without causing other health implications will provide information that will be helpful when determining the appropriate diet for type 2 diabetics. Additionally, it will be of great benefit for the research community to define how many carbohydrates are included in a low carbohydrate diet. This will make the comparison of studies easier, especially for long-term studies looking into other effects of the low carbohydrate diet. Similar recommendations exist for yoga, herbal supplements, and exercise. Additional long-term studies that elucidate the effects of the intervention on both blood glucose levels and other body systems will help to delineate the appropriateness of their use for type 2 diabetic patients. Additional studies into how yoga affects blood sugar will allow practitioners to recommend movement protocols to their clients that include a specific type or amount of yoga that will be most beneficial to the client. With most type 2 diabetics living sedentary lives, increasing movement will be key to blood glucose management and for their overall health. As practitioners learn more, they can help their clients create a more well-rounded wellness plan. Given the impact of herbal supplements, low carbohydrate diets, exercise, and yoga on the hyperglycemia of type 2 diabetics, practitioners can feel confident in suggesting these as part of the wellness plan, perhaps concurrent with or instead of pharmaceuticals. Practitioners can use this information to empower type 2 diabetic patients with knowledge and understanding to encourage the patient to make dietary and lifestyle changes that can help them with losing excess weight, controlling their hyperglycemia, and reducing or removing their need for pharmaceuticals. Pharmaceutical medication for type 2 diabetics can be extremely useful and can be life-saving, but there are many diet and lifestyle modifications that can be used to prevent, reduce, or delay their need.